I'm Eric Ruiz, the EL. Next to me is Amy De Los Santos, the co-EL, Miss Lori Simmons, who's our IM, and Dr. Arturo Fuentes, who's our PI. Together, we're STXCryo. We developed a medical device which aims to streamline and facilitate current blood component production processes. We initially thought our customers were lab technicians in hospitals and blood banks for both the human and animal markets. We felt we had such a great idea that every lab technician would want it because it would make their life easier. We assumed we could get it to market, sell it, and make some money. We applied to the NSFI Core program to help us validate the different elements of our business canvas. Well, on day one of presentations, we were drilled by the teaching team and got a huge wake-up call when we were asked questions we simply did not have the answers for. We were then kicked out of the building to begin our customer discovery. We visited large cities across the U.S. in states such as California, New York, Maryland, North Carolina, and Virginia.
Some of our experiences involved being bullied by a little elderly receptionist, some bad weather, flight delays, and in one case, there was even a fight on a plane. In New York, we were escorted by police in some hospitals. I also dealt with a dancing EL. In some instances, members donated blood to get an interview, but yet it was difficult getting the minimum interview count for the week. We were also accused of being vendors, and in some interviews, we were even interrogated by the interviewees. People thought we were the FDA, even animal rights activists. Even though everyone was treated with kindness and respect, we did get kicked out of some facilities due to the sensitive nature of some information. I also came down with the flu during one of our customer discovery trips.
What we learned throughout our struggles is, for starters, the ecosystem was much more complex than anticipated. Our potential customers were not the laboratory technicians in hospitals and blood banks, and we needed to get more specific. We narrowed down our potential customer segment to blood component manufacturers and discovered the need to go through a product validation process.
Throughout all the conducted interviews, we learned that our initial market doesn't even want our proposed technology. They had other needs that were much more important to them. We decided to pivot the technology to fit the market. We are developing our new technology and further validating its need in alternative markets. Overall, we were exposed to a plethora of other opportunities and gained a valuable toolset we can use in the future.